So we're going to do the one of our additional in the series of reading your scoring tool. Okay, and we emphasize the importance of your scoring tool. It's very important that you compare your scoring tool against the critical elements that are actually in the study guide, and it really helps you understand what's going on and what you're going to need, what the CE is looking for you to do while you're in the patient's room. Okay, so the next one we're going to do is we're going to do comfort management. So we're going to talk about this management right here, where they've given you the assignment that they want to manage the patient's comfort. Okay, now our mnemonic is going to be assess with the comfort scale that the CEs give you. You don't have to figure this out. The CE is going to give you the scale. Okay? The 2 in the second part is 2 interventions. You must do 2 interventions for this particular management. Okay? Now some of the rest of these are going to be the interventions that you can do for the patient. Okay? So some of the interventions that you can do, and don't be shy or don't be alarmed or don't be surprised if the CE doesn't give you one. I had a PCS where they actually gave me, I want you to change the patient's linens while you're in the room. So she gave me one of my interventions. Yay. Okay? So that was a good thing for me. But remember that this is the list that you will pick from, and we want you to pick things that you think that you can get done in the room. Okay? So the need to reposition, you can reposition the patient for comfort management. Distraction. Well, let's talk about reposition. Reposition includes lifting the bed up, head of the bed up, lowering the head of the bed, fluffing the patient's pillows, sliding them back up in the bed, and getting their covers straight. That's a reposition on a patient. Taking a patient, turning them from one side and like a scheduled turn to going to do a scheduled turn on a patient, that's repositioning the patient. Okay? So make sure that you understand what repositioning actually means. And there's a few things that you could do for the patient, which actually leads you to, and this is a very easy thing to get done during patient comfort management. Okay? It's usually a very easy thing to get done, and you can ask questions during report. Hey, are you turning them? Are they getting turned? Or can I just reposition them? Okay? Distraction. What could be a distraction? Television, iPad, a magazine. Turn the TV on, turn the TV off. You know, removing the distractions sometimes can do that. Those are things that you can do. What about closing the blinds? What about opening the blinds to let the sunlight in and let them see what's going on in the outside world? That could be a distraction also. I had a patient who actually said, you can get that old crotchety old man out of my room over here. He's about driving me up the wall. You know, so there could be a number of different ways you can use to actually either remove a distraction or distract the patient. Okay?
Can I distract with communication and talking with patient? Will that be considered an intervention?
Guided imagery.
Guided imagery usually is more of a pain intervention, but yes, you could actually guide the patient to a distraction. Yes. Okay? Anything that falls under that's going to distract the patient away from their comfort, their discomfort, is going to be considered distraction.
It has to be specific, like you have to say distract with TV or giving magazines or something like that.
No, I think it's just a general provided distraction for the patient during a PCS. If you actually specify that you're going to turn the TV on and you walk in there and the TV's already turned on, then you have to change your plan of care. So you kind of put yourself in a box. Try not to put yourself in a box and be thinking about interventions that you feel 99.9% confident you can get done. Okay? Yeah, plus, if that's only if comfort is your primary care plan too. Remember, if that's your priority care plan that you're going to write your priority care plan on, then yes, you have to specify. Okay? Cold or heat, if they order you to put a hot pack on or a cold pack on to the patient, then you can use that as one of your interventions, but you cannot do that on your own. They have to order. That's one of the interventions they have to order you to do. Okay? Hygiene. The CE tells you to do it.
Oh, okay.
It's actually listed as one of the interventions under comfort management. They'll check it, and it's up to you to know how to do it. Okay? Hygiene. Face, hands, and oral hygiene. So let's talk about each one of those individually. Actually do the face and the hands at the same time. No, you don't get a basin of water and dunk their face in it, and let them catch their, let them drown in the water to wash their face. You literally take a clean washcloth, you put it underneath the hot water, you get the water as hot as you can get it, you wring it out real good, you hand it to the patient, you let them wash their face and wash their arms off. It is wonderful. Patients love it. Okay? It's like they love that hot washcloth to wash their face and their hands off. Now obviously you don't want to scald them, that's why you wring it out with your hands to make sure it's not too hot. Okay? That's a simple face wash. Alright? No soap involved. The other is oral hygiene. You may help them brush their teeth. What if they're your first patient on Saturday morning? You're actually going to walk in there. You're going to help them freshen up. You say, hey, you want me to help you brush your teeth after you've eaten? Yeah. Well, then you have to go through the process of brushing the teeth properly with the patient. But that's, I'm not here to tell you how to do that. I'm just telling you that's one of the things that you can do. That's a separate video. I'm telling you how to do it to brush somebody's teeth. Arranging or changing the linens. You know, the patients get their linens all wrinkled up and everything, and it becomes uncomfortable. It becomes irritant, right? You can straighten their linens out for them. Or you can actually change their linens. So if you don't know how to change the linens with the patient in the bed, you need to learn how to do that. I'm not here to teach you how to do that stuff. Okay? I'm just going to tell you that you can change a patient's linen as a comfort intervention. Okay? Needing meds, and these are comfort type medications like your Benadryl, your Tylenol, your Motrin, simple things that are going to help with comfort. We're not talking about Toradol or some of the harder morphine or Dilaudid or things like that, things that you're not going to be able to give the patient. These are just simple little comfort type medications that you're going to be allowed to give them. And once again, it's either a PRN order set, and you don't really know what their level of comfort is going in, do you? So you can't really say I'm going to give them medications. We've had students put that on their primary care plan. We're going to administer medications, and they walk in and they said, I just had that 30 minutes ago. They got to change their plan of care. So be careful with using medications as one of your interventions on your primary care plans. If you walk in and they haven't had it and it's not your primary care plan, you can always do that decision on the fly, right? Do you understand that? Does anybody here understand that? You can make that decision, but if it's on your primary care plan and you walk in and they just had that medication, you'll have to revise. So my point is, be careful putting medications on your primary care plan. Comfort rub. It sounds kind of hinky, doesn't it? It sounds kind of funny. And it really isn't. It's very simple. All you do is you sit the patient up, you lean them forward, you take a warm washcloth, and you wipe their back off for them. That's it. Then you take a dollop of lotion, you put it in your hands, you put it on the patient's back, and you rub that lotion in until the lotion disappears. Boom, that's it. That's all that is to this management. All right? Now, use your bare hands. Don't use gloved hands. If you put gloves on and you put that lotion on there, within about 30 seconds it's going to start sticking, and it's going to start sticking to the patient. It's going to become an irritant then. Okay? So if you have an issue with putting your bare hands on a patient after you've washed it off with a warm washcloth, putting lotion on their body, then you don't need to pick this as an intervention. Okay? This is all about the patient's comfort, not your comfort. It's a wonderful intervention. I used it a couple of times during my CPNE. Okay? So it really helps, and that's the way you want to do it. Environmental adjustments. What does that mean? That also kind of goes back to the blinds. You can open the blinds, you can close the blinds. Turn the TV on, turn the TV off. You can. What about turn the air conditioner on and turn the heat on? What about getting them a blanket? Taking the blanket away. You want me to take, this looks hot from you. You want me to take that blanket away from you? These are all environmental adjustments that you can make. Okay? You could probably argue taking their getting their bedside commode, put it closer to the bed. That could be an environmental adjustment. Okay? All right? So, but those are things that you don't know going into the room. You don't know these things in advance. And if this is your primary care plan, you need to have 2 interventions on your primary care plan you feel 100% certain you can get done. Okay? Relaxation. I think relaxation may come under the guided imagery to kind of, I'm not real sure, but all I know is that you need to make sure that you reassess after every intervention. Now, doesn't that feel better? Those are things that you need to do. After every management intervention you do, you always reassess. Doesn't that feel better? Don't you feel wonderful? Doesn't it feel great to get out of that bed? Doesn't it feel great to get your back cleaned off? Doesn't your mouth feel wonderful now? You know what I'm saying? So you always have to reassess, and then you have to record what happened. Okay? Now, let's go over the critical elements. Let's go to the scoring tool. You also have to use, first thing you got to do is determine the learning needs related to comfort. Determine the comfort using the correct scale. Now you have to remember there's a DAISY scale, there's a verbal rating scale, and there's observed behaviors. Observed behaviors are usually going to be for the young folks or the non-communicative older folks. They may have to use their actual visual cues. The comfort DAISY scale usually will be for a pediatric child. But remember, you don't have to know these scales because they give them to you in the packet. You do need to study them and go over them. And then, of course, the comfort rating verbal scale, which is 0 to 10. And the 10 is the best possible comfort rating, and 0 is the worst. Either you don't have any comfort at all, or you have 10, the best comfort in the world. Remember, it's just the opposite of pain. Okay? So they want you to understand that. Once you've determined their learning needs, they want you to teach them something. You've got to teach them something about their comfort, like the importance of keeping their bed covers without creases in it. Is that important? It isn't. For a bedbound inpatient, that's very important. Okay? Or keeping their room at the right temperature that's comfortable for them so that they can sleep properly. Is that important for a patient? Their rest is important? Yes. And usually I've actually teach my patients, teach them about the interventions you're going to perform. Teach them about the importance or the benefits of the interventions that you're going to be doing for them. It's easier for you to understand. You don't have to go off the reservation. You can literally teach them about the interventions that you gave them, the benefits or the importance of it. Okay? Hold on one second. Let me get finished. Provide education based on the learning needs. So always, once you talk to them about the interventions that you're going to give them, always ask them what you taught them. And I tell you, when you do learning, when you do patient teaching, you'll see on some videos and other places where they'll actually teach them, and then they wait 10 or 15 minutes later to ask them what they taught them. My position is, find out what you're going to teach them, make sure that they're ready for you to teach, then teach them, and then right there on the spot, say, could you tell me what I just told you? Or could you tell me what the benefits are of what I just told you? That way you get the patient teaching out of the way. Does that make sense? Yes, sir.
Quick question. The education, do you do the education before the intervention, or do you do the education after?
I'm going to get into when. I'm going to get into when on a later date. Right now, they're just looking for you to assess the patient's learning needs or their ability. Hey, look, I'm going to be teaching you during this. Is that okay? Yes, that's fine. Then they're going to look to see if you're teaching the patient. Then they're going to look to find out if the patient understood and how you determined whether or not the patient understood. Does that make sense? So anytime you do a management, you must teach them. And you have to cover those 4 things. The learning needs, or letting them know that you're going to teach them. Teach them what you're going to teach them. And then they have to verbalize it back to you. What did you teach? Okay? You got it? Then you're going to have to provide 2 of these actual interventions up here. They want to make sure that you do the interventions, and that after each intervention, they want you to they need to see you reassess whether or not the interventions helped. Once you perform those 2 interventions, they want you to reassess the patient using. Once you've performed all your interventions, then you have to reassess using what?
Comfort scale?
The scale that they gave you to use. Do you have to know the scale? No, because they're going to assign you the scale. You don't have to know which scale to use. They're going to tell you which scale to use. Then you have to document the education that you provided, whether or not the patient understood the education, the comfort assessment scale method that you used, What was their comfort assessment prior to your interventions? What was their comfort assessment after your interventions? And then any patient preferences that they had for comfort needs? And what comfort interventions did you implement with the patient? And then lastly, they're going to want to know, did it help? You got it? So I'll talk about goals and things like that here a little later on in another video. When we teach it. But right now, what we're trying to teach you is, what is this CE looking for you to do under comfort management? Does that make sense? The specifics we'll get to in another video. Any questions about comfort management as far as what is the CE looking for?
That comfort scale will be assigned. We do not have to guess which comfort scale.
You do not have to guess which comfort scale it will be assigned. Correct. Any other questions? All right, that's comfort management.